If your healthcare providers have recommended range of motion exercises, the following will describe the steps you take to increase wrist extension. The purpose of this activity is to increase motion and flexibility of the joint, to minimize the risk of tightening the muscles and tissues, also known as a contracture, to maximize the movements for functional tasks. Range of motion activities will cause discomfort for the person, but daily stretching is important to the person's recovery. Precautions for this activity. Any activity restrictions from the surgeon. Pain that is not typical for this person. Any active infections in the area. Monitor the person's tolerance and endurance for this activity. Discontinue if the person is not tolerating the activity. Items needed for this exercise. Clean, gloved hands. A bed or an appropriate supportive surface. Have the person lie down on their back. Approach the person from the side you will be stretching, in this case, the right side. Depending on the height of the supporting surface, you may be more comfortable sitting in a chair next to the person, or you may stand. Instruct the person to relax. Turn their palm to the floor and let you move their wrist. Place your right hand on the bottom of the person's hand with your thumb resting on top of their hand. Place your left hand in the middle of the person's forearm to stabilize. Slowly move the person's hand upward and toward them, applying the force through your right hand until you feel resistance or the person is reporting a good stretch. Stop the stretch if the person is reporting pain that is abnormal to them. Once you attain the end of the stretch, hold the position for 30 to 60 seconds. Slowly begin to move the hand back down to the resting position. Repeat this stretch 3 to 5 times, holding 30 to 60 seconds each time. This material is offered solely for educational purposes. It does not replace occupational therapy prescribed by your physician. The information provided in this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Stop an exercise if it causes pain or discomfort. If pain or discomfort persists, seek medical attention.